And we should also share the screen and go back to our presentation. Well, the last piece of information was here on this slide. So here it is. And let us summarize what we've learned about improving concordance. So let us look at the questions here on this slide and try to answer them. Let us listen to Manish. The first question is for you.
Yes, ma'am. What features of new medicines should people take the medicines prescribed to them? They should have the medicine should have favored side effects and which are more convenient to use.
Exactly. Yes, good. Well, Pradeep.
Yes, ma'am. Which medicines are least likely to be taken by patients?
Which medicines? So if we go to this, information is here.
Yes, ma'am.
So Pradeep,
Raised cholesterol levels and hypertension.
So, but in general, what type of the connection is bad? So who can answer this question?
Preventive type of preventive
medicines. Okay. So if we go to the next yes question, let us listen to Rohita.
Yes, ma'am. Which group is more likely not to take medicine prescribed because they do not believe the illness is there?
Which group of people do not believe? So the information is here.
Denial of illness, especially among younger people, ma'am.
Yes, young people, they do not believe in illness. Okay. And so is Bhovanesh here? No. So Hita, please.
Yes, ma'am. Besides providing information, what effective ways can improve compliance? By emotionally supporting them.
And introducing
complementary use of educative, practical, and emotionally and behaviorally supportive interventions.
So also there should be some self-management programs, yes?
Yes, ma'am.
Okay. Well, let's listen to Afnan.
What is more important than increasing compliance in patients? It is
okay, so
can differentiate clearly between situations where varying the time, quantity of medicines doses.
And doctors should focus on what?
Patient's point of view.
Yes. Patient's needs, individual needs. Yes. Okay. Well, now Khadija. Khadija, are you here? No, Khadija. So, Musharafuddin? No. Mayuka, please.
What do patients need to be helped to make?
What should the doctors help the patients to make?
prescribing instructions, meeting patients individually, and their priorities.
So patients need help to make
Informed choice about treatment.
So the doctors provide information, and that in such a way they help the patients to make their choice because they know everything about medications. And now, please, is Rina here?
Yes, ma'am. What can be of help to both the individual and the general population?
So the answer is here.
Self-management.
Yes, self-management. Yes, can help. Okay, so I hope this information is useful for you because you will be dealing with patients in your future career, and so you should be aware of the fact that concordance is how to improve the concordance, and concordance is not always 100%. Okay. Well, and if we continue speaking about side effects, here is the cartoon when a doctor just looking for some side effects of Astrozenicar, and he can see the shortness of breath, chills and sweating and trembling in his patient, but the nurse says that she hasn't injected him yet. So, and speaking about side effects, now we are going to analyze some modal verbs, the verbs can and may. So they are used to show that a drug or medicine causes side effects in some people. And in this, so we need to understand the difference between can and may. So both words are used to express possibility, as you see, but can expresses a theoretical possibility, while may expresses a real possibility. And we can understand this looking at the two examples which are given here on this slide. So the first example with can is the door can be blocked. So this is theoretically possible. It is possible to lock the door. Right now, it is either locked or unlocked. So, and another sentence is with may. The door may be locked. It is possible that the door is locked right now. If it is locked, we won't be able to open it. So you should understand this slight difference in the meaning of these modal verbs. And if we move to the next slide, there are some more examples with can. So can is used to say about a side effect, that a side effect is possible. Like in the sentence, the medication can cause some stomach irritation. It means that it is possible for this medication to cause some stomach irritation, and can indicates that stomach irritation is a possibility. To reassure patients, you can emphasize that the side effect is theoretically possible, but not of serious concern to the patient you are talking to. So it means this occasionally causes stomach irritation in some people, not in everyone. And sometimes people get stomach irritation with this, but it isn't usually a problem. So there is a slight possibility that this can happen to you. This is the meaning of can when it is used in the conversation about side effects, about possibility. And if we speak about may in similar context, may also expresses that a side effect is possible. And the meaning of the sentence, this medication may cause some stomach irritation. The meaning of the sentence is, it is possible that this medication will cause some stomach irritation. So the possibility is higher here. In this case, may indicates the possibility of the treatment being or becoming true. So the word may in this sense is frequently stressed and indicates that stomach irritation is a strong possibility. You may want to emphasize this. There's a strong possibility that this will upset your stomach. So do you understand the difference? If we use can, the possibility is lower, but we use may to show the strong possibility that something will happen. So, and if we move to the next slide, here we can see the practical exercise where we need to use to complete the gap with the words possibility, may, will, can, probably, may not. For example, here we have a look at the first sentence. So let us listen to Bhargavi. Will you read the first sentence, please?
In some people, it can cause a fleeting headache, but it doesn't mean that you will get one.
Doesn't mean that you will get them. Okay, so please look at the other sentences, and you see that the words should be used only once. And please analyze and write the sentences with complete them with these words. So a couple of minutes for you. Start, please. Are you done?
Yes, ma'am.
Okay, so let us listen to Vidya. The second sentence, please.
Yes. Theoretically, this can cause low blood pressure, but you probably won't have a problem.
Do you all agree with this option?
Yes, ma'am.
Theoretically, it can cause, but so when we use can, it means okay, you won't. You probably won't. Okay. So what about number 3? Let's listen to Lahari.
Yes, ma'am. Some people get blurred vision, but it may not happen in your case.
Okay. So Good. The next is for Manish.
Yes, ma'am.
Number 4.
There's a strong possibility that this will upset your stomach. In fact, it may make you feel really ill.
A strong possibility, yes, a fixed just expression. Okay, Pradeep.
Swelling of the ankle is not common, but it is possible. It may happen.
Look, it's not common. Should we use can or may here?
Can.
Can. It's better to use can because it's the possibility is very low. Okay, so Rohita. Rohita?
Yes, ma'am.
Number 6, please.
This may make you feel dizzy, so you should be careful when you drive.
So it is possible that you will just feel dizzy. That is why we use may. This may make you feel dizzy. Good. So, and before we go to this, I would like I remember that last class when we were looking at your presentations, you were speaking about so different tests and procedures. There were some students who didn't present anything. So we didn't hear Khadija. We didn't listen to Khadija. Khadija, you're here. Unfortunately, they are absent. Yes, both of them, Khadija and Musharifuddin. I see, okay. All the rest presented the procedures, right?
Yes, ma'am.
Yes, ma'am.
Good. Okay, now let us look at the next slide. Yes, who is singing a song? Well, and here there is a writing task. You see, we should write sentences about the benefits and side effects of the sedative diazepam using the phrases like, in some cases, the tablets can, or there are some people, theoretically, this can cause. I mean, these are the sentences that start similarly as in the previous task. So because here, these sentences were also about side effects. So please think about diazepam, what you know about this medicine and medication. And so please write several sentences starting with the phrases presented here on the slide. Is the task clear?
Yes, ma'am.
So please,
Yes, ma'am.
just 5 minutes to you to write. Start, please. Okay. So let us check what we've written. Who would like to read about the benefits and side effects of diazepam?
Can I, ma'am?
Your name is?
Bhargavi, ma'am.
Bhargavi, please.
Yeah, in some cases, the tablets can cause tiredness or dizziness, or and in some people, it may lead to it may cause muscle weakness. These are the side effects. Whereas benefits, these tablets, in some cases, these tablets can treat the anxiety. There are some people who feel nausea, who get nausea, and theoretically this can cause constipation.
Okay, good. So, do we have anything to add to this? Does anyone have some extra ideas, more ideas?
There are some people with allergic reactions to this drug.
Yes, it's very important. So we should be very careful and first test the medication. Okay, good. So, and if we speak about allergic reactions, so sometimes it happens that the doctors didn't pay attention to allergy of their patients, or they prescribed some medications with their own dose. And so this is called clinical incident. And if such an incident happens in a hospital, they should report about this. And so here is the reporting form. And let us read the sample clinical incident reporting form just to understand what happened in this hospital. Who would like to read it? Now, volunteers.
Ma'am, can I?
Your name?
Vidya.
Vidya, please.
Name of staff involved: CJ Flint, grade and specialty PRHO medicine, agency or locum NA. Brief details of incident: patient was prescribed
Yes.
augmentin 625 mg per 8 hours. And despite penicillin allergy, this was stated on drug chart. This was noted by the pharmacist, and the patient did not take any augmentin. The team PRHO was contacted, and an alternative antibiotic was prescribed.
And we see 625 milligrams every 4 hours. And what is the way of administration for you?
By orally.
By mouth.
By mouth.
By mouth.
You're right. Okay, this is the way the case is described here. And if we have a look at the next slide here, we can see there is information about another clinical incident, and there are some notes from reporting form, and it was a near miss, also a near miss incident. Let us look at the notes. So there is information about the name of the drug, the dose, about way of administration, and what happened, and the names of doctors who prescribed and who prevented the use of this drug. So please look at these notes and write just full sentences. Describe what happened in the hospital. So please write the sentences. Well, also 5 minutes to you. Start, please. Well, let us check what we've written, and who would like to read?
Ma'am, can I?
Your name?
Sohita.
Suhita, please.
The patient was prescribed flumazenil 200 mcg intravenously up to 1 mg. He is epileptic as mentioned in his drug chart. This was noted by Dr. Duncan. And the patient did not take flumazenil. He contacted Dr. Zou's team who prescribed him an alternative drug.
Exactly. Yes. Well done. Thank you. Okay.
Thank you.
So just I hope it won't happen in your real medical practice, but sometimes so just to prevent similar cases, we need to know how to write the clinical incident reporting. And so we should speak about our